certainty we all share, but the how and why of death is not evenly distributed across humanity. From affluent cities with high tech hospitals to remote villages with limited healthcare access, the causes of death reveal as much about inequality and environment as they do about biology. In our modern era, the majority of deaths are no longer from plagues or predators, but from chronic diseases that creep up silently, often years in the making. Yet, beneath the sobering statistics lies a powerful truth. Many of the leading causes of death are preventable. Through science, policy, education, and access to care, we can extend life and improve its quality. The following narrative journey through the world's top causes of death, interweaving the hard science with human stories, and always pointing towards prevention, resilience, and hope. The silent seas of heart disease. Every year, cardiovascular disease claims the lives of nearly 18 million people worldwide, making them the leading cause of death. The battle begins silently with plagues forming a arteries, blood pressure slowly rising, and hearts working harder with each beat. Unlike the dramatic heart attacks portrayed in films, many people die from heart disease without ever knowing they had it. Coronary artery disease, the most common artery form, arises when fatty deposits, atherosclerotic plaques, accumulate in blood vessels supplying the heart. These plaques restrict blood flow and when ruptured, trigger clots that can block arteries completely. A similar mechanism can lead to strokes, especially when vessels in the brain are affected. But the real tragedy is not prevalence. It is the preventability. Diets rich, diets rich in saturated fats and processed sugar, sedentary lifestyle, chronic stress, and tobacco use contribute massively to heart disease. A culture of convenience has given rise to a global epidemic of poor heart health by vitamins and supplements. Prevention lies in embracing what our ancestors knew intuitively: move often, eat naturally, sleep well, and maintain strong social bonds. Routine screening for blood pressure, cholesterol, and diabetes plays a critical role. Cardiology may be an advanced science, but its greatest achievements still hinge on basic lifestyle changes. The breathless toll of stroke, often considered a cousin to heart disease. Stroke is another vascular catastrophe, this time affecting the brain. It occurs when the blood supply to part of the brain is interrupted or reduced, depriving brain tissues of oxygen. Within minutes, brain cells begin to die. There are two main types of stroke: ischemic, ischemic caused by blocked arteries, and homeopathic hemorrhagic caused by leaking or burst vessels. The former accounts for nearly 87% of all cases. Stroke kills over 6 million people annually and disables million more. Survivors often struggle with speech, memory, and motor control. It is not just a medical crisis, it's a life altering rupture of identity and autonomy. But here too, prevention is profoundly effective. The risk factors for stroke mirror those of heart disease, hypertension, smoking, high cholesterol, obesity, and diabetes. Reducing salt intake, managing stress, engaging in physical activity, and moderating alcohol consumption are life saving strategies. Equally critical is awareness. Knowing the sign of stroke, sudden confusion, weakness, difficulty speaking or seeing, and seeking immediate care can mean the difference between recovery and lifelong disability. Lung cancer, that the breath that betrays. Lung cancer is one of the deadliest malignancy worldwide, claiming more than 1.8 million lives annually. Unlike some concern that progress slowly are detected early, lung cancer often spreads before it shows symptoms, but the time is persistent cough or chest pain sends someone to the doctor. The disease is often advanced. The number one cause, smoking. And tobacco smoke delivers a carcinogenic cocktail directly to the lungs. More than 70 of its chemicals are known to cause cancer. But even non smokers are not safe. Exposure to second-hand smoke, radon gas, air pollution, and occupational chemicals like asbestos contribute significantly. For many, quitting smoking is the single most transformative health decision but they can make. Public health efforts like anti-smoking campaign, clean air laws, and higher tobacco taxes have already saved a million of lives. But disparities, disparities remain. Low income communities and developing nations bear the brunt of tobacco related deaths by vitamin and supplements. Prevention then is not just a personal effort, it is a societal responsibility, empowering people to quit, protecting children from early exposure, and addressing the social drivers of tobacco addiction remain critical. Please subscribe, like, comments. Thank you.